Viral Disease Branch. She's the Associate Director for Laboratory Science for the division. And in addition, she is also in the policy office, works with the policy components of CFS and other issues within that division. And she's with us today, and she's been in constant touch with this committee through me and through Sarah Wiley, as you recall, who was here before. And so Kim is very, very up to date with the committee and will remain so from our policy standpoint. I just wanted to acknowledge her presence today and get to meet her. So, there she is. Okay, thank you, Kim. Okay, thank you.
Thanks. So I know that Dr. Holmberg's presentation at the last meeting was one of the high points of the meeting. So I, for one, can't wait to hear his update. But thank you.
Well, thank you. I have passed out 2 documents to you. The first one is that's going around on this side will be the copies of the slides that for today's presentation, and then going around on the other side, which eventually will get over here, is a 3-page fact sheet on XMRV. Let me first by saying that I want to thank you all for letting me come here and to give you an update on the XMRV and work that we've done with the scientific activities. Next slide, please. As you can see, our tagline for our Office of Public Health and Science is mobilizing leadership in science and prevention for a healthier nation. And I really want to stress in my presentation today the coordination that my office is doing to try to ensure the safety of the blood supply as we investigate the potential relationship with chronic fatigue syndrome. I want to say that the responsibility that I've taken on in blood safety and availability is to coordinate the department's response in understanding XMRV detection, prevalence, epidemiology, and if disease causing in humans, the prevention of disease transmission through blood and blood products. We've really started out since November looking at different methods of detection, looking at the standardization and the validation. We also are looking at doing a risk assessment. We're putting pieces of that together, but once we can start doing some epidemiology studies and determining the prevalence, we will then be able to have a bit better handle on the risk assessment, and then of course following a risk assessment would be our risk management of controlling XMRV. Next slide, please. This slide, I apologize, did not come out very clearly on the overhead, but at least you have this in front of you, and I will go through this. One of the things that my office has done is to really try to coordinate a lot of activities, and that third bubble down is really myself as the Senior Advisor for Blood Policy, and we have what we call the Blood, Organ, and Tissue Senior Executive Council, which really involves the leadership, the senior leadership from all of the public health services. And then also we have a monthly blood, organ, and tissue safety call that is on a monthly basis, and it also includes more of the working level people involved in blood, organ, and tissue safety. We have different working groups that have responded to several needs. In fact, we have an emerging infectious disease working group that is a standing committee that really reports on a monthly basis different things or things that we're keeping our eye on and reports that back to the blood, organ, and tissue safety. With the events of what happened in October with the reporting in Science, we did stand up a blood scientific working group for XMRV, and also we collaborated with the AABB, which is our our private sector partners, and they actually have pulled together a group which includes both external to the government and internal to the government individuals that can address some of the issues related to XMRV and relationship to blood. The head of that committee at the AABB task force is Dr. Harvey Klein, who is head of transfusion medicine at National Institutes of Health. And so he not only sits as the chair of that committee, but also is working with us on the monthly blood, organ, and tissue safety calls, and also the Blood, Organ, and Tissue Senior Executive Council. I have to say that both of these committees over on your right-hand side, the working group, the blood XMRV scientific working group, and the AABB task force has been meeting. We're probably in communication almost daily, but definitely on lengthy telephone calls at least every 2 weeks. And Nancy was privileged to join us this last on the 28th of April. Next slide, please. If I can break down some of the work that we've been doing with the XMRV in the Blood Scientific Research Group, and let me just back up and say, I don't think I pointed it out on the previous slide, but let me just say that the person that is chairing this for me and really working on it, she claims we're co-chairs, but really she takes a lot of the work on it, and this is Dr. Simone Glenn from the National Heart, Lung, and Blood Institute. And she is at the helm there, primarily with her responsibilities with the retrovirus epidemiology donor study. And that is a study that was established in the early 90s. We will be finishing up in December of this next year on REDS 2, and we'll be starting REDS 3 shortly thereafter. There was a quantitative phase of our investigation in which we had to quantify some of the cell lines that were available. Both cells and supernatant were sent for quantitation to the numerous laboratories that we are working with. There's right now about 6 participating laboratories within the government and also outside the government, including Whittemore Peterson Institute. Once we were able to quantify the number of viral copies in that, either in the cell or the supernate, we then moved on to the analytical panel. And at first, the goal was only to have 10 panels. But when we started adding the number of laboratories, even within the government, that were interested in trying to standardize their procedures, we quickly moved that number up to 15. And the reason for that was that we were also starting to get some requests from outside the United States. And our feeling was that if we create this once, let's go ahead and standardize it across so that we can corroborate and collaborate with our partners even outside the United States. The cell that is used in the analytical panel is the human prostate cell line 22RV1. There's 6 participating laboratories: CDC, 2 at FDA, National Cancer Institute, Whittemore Peterson Institute, and the Blood Systems Research Institute. The Blood Systems Research Institute is the major contract laboratory for the REDS 2 study, and so that's why they are participating there. We have almost all of the results back from the analytical panel. This was sent out in March, and there is 1 or 2 facilities that are still waiting. We're waiting for their results, and that should be to us within or by June. We are also we came up on several problems, and in order to face those problems, we have engaged in pilot studies, and even the pilot studies sort of got detained a little bit because of going through the institutional review boards. So that has sort of set us back a little bit. But one of the things that we have to do is to identify the time between collection and preparation of the sample and the differences between the whole blood preps and the peripheral blood mononuclear cells, or the PBMCs.